Hello everyone, now let us see 2023 CPT coding guidelines for surgery digestive system part 8B. In the current session, we will be focusing the CPTs in the range 43770 to 43999. We have covered some topics of stomach in part 8A, and in 8B we are discussing about the bariatric surgery and other procedures. The CPT range for bariatric surgery is 43770 and 43775. 43770 to 43775, and for other procedures it is 43800 to 43999. First of all, coming to bariatric surgery. Bariatric surgical procedures may involve the stomach, duodenum, jejunum and or the ileum. Under it you can find laparoscopy. So as we have said earlier, surgical laparoscopy always includes diagnostic laparoscopy. And typical post-operative follow-up care after gastric restriction using the adjustable gastric restrictive device includes subsequent restrictive device adjustments through the post-operative period for a typical patient. So the adjustment of gastric restrictive device is included in the post-operative follow-up care. And adjustment consists of changing the gastric restrictive device component diameter by injection or aspiration of fluid through the subcutaneous port component. It consists of changing the device component diameter by injection or aspiration of fluid through the subcutaneous port component, and that is included in the post-operative follow-up care. So you need not code separately. Adjustment of gastric restrictive device after the surgery, gastric restrictive surgery. Now coming to the first CPT, 43770. 43770 deals with laparoscopy surgical gastric restrictive procedure, placement of adjustable gastric restrictive device, example gastric band or subcutaneous port components. And for individual component placement, report 43770 with modifier 52 to indicate reduced services. The next is 43771. It deals with laparoscopy surgical gastric restrictive procedure, revision of adjustable gastric restrictive device component only. And 43772 deals with laparoscopy surgical gastric restrictive procedure, removal of adjustable gastric restrictive device component only. For revision, the CPT is 43771, and for removal it is 43772. And for removal and placement of adjustable gastric restrictive device component only, the code is 43773. For the revision, it is 43771. For removal, it is 43772. For removal and replacement, it is 43773. And do not report 43773 in conjunction with 43772. The next CPT is 43774 for the removal of adjustable gastric restrictive device and subcutaneous components. Previously, it is only gastric restrictive device component, but now removal of both adjustable gastric restrictive device and subcutaneous port components. And for the removal and replacement of both gastric band and subcutaneous port components, you need to use 43659. The next CPT is 43775. It deals with laparoscopy surgical gastric restrictive procedure with the longitudinal gastrectomy, that is sleeve gastrectomy. And for open gastric restrictive procedure without gastric bypass for morbid obesity other than vertical band gastroplasty, you need to use 43843. Now let us see an example. What CPT codes are reported for gastric restriction by placing a gastric band via laparoscopic surgery for an adult patient diagnosed as morbidly obese having BMI of 43 with type 2 uncontrolled diabetes. Here, gastric restrictive procedure is performed by placement of gastric restrictive device and the device is gastric band. So the correct CPT is 43770. Laparoscopy, surgical gastric restrictive procedure, placement of adjustable gastric restrictive device, example gastric band and subcutaneous port components. Coming to other procedures. This is the final topic in stomach. The first CPT is 43880. It deals with pyloroplasty. For pyloroplasty and vagotomy that we have discussed earlier, you need to use 43640. The next is 43810 is coded for gastroduodenostomy. Gastroduodenostomy is coded with 43810. And gastrojejunostomy without vagotomy, the CPT is 43820. And if gastrojejunostomy is performed with vagotomy any type, the CPT is 43825. The next CPT is 43830. It deals with gastrostomy open without construction of gastric tube. Gastrostomy open without construction of gastric tube. It is not a laparoscopic procedure. It is open. Next, 43831. Gastrotomy open without construction of gastric tube. Neonatal. If it is performed on a neonatal for feeding, the CPT is 43831. The next is 43832. Gastrostomy open with the construction of gastric tube. The CPT is 43832. Next, 43840. It deals with gastrorrhaphy, suture of perforated duodenal or gastric ulcer, wound or injury. Gastrorrhaphy, which is nothing but suture of perforated duodenal or gastric ulcer, wound or injury. Next is 43842. It deals with gastric restrictive procedure without gastric bypass. Gastric restrictive procedure without gastric bypass for morbid obesity, vertical banded gastroplasty. And if it is other than vertical banded gastroplasty, the CPT is 43843. Complete description of 43843 is gastric restrictive procedure without gastric bypass for morbid obesity other than vertical banded gastroplasty. Oplasty is nothing but surgical repair. Next is 43845. It deals with gastric restrictive procedure with partial gastrectomy, pylorus preserving, duodenostomy and ileostomy. Duodeno-ileostomy and ileostomy. 50 to 100 centimeters common channel to limit absorption. The next is 43846. Gastric restrictive procedure with gastric bypass for morbid obesity with short limb, that is 150 centimeters or less. ROX N while gastroenterostomy. For greater than 150 centimeters, you need to use 43847. And for laparoscopic procedure, you need to use 43644. The next CPT is 43847. It is for greater than 150 centimeters with the small intestine reconstruction to limit absorption. The next CPT is 43848. Revision open of gastric restrictive procedure for morbid obesity other than adjustable gastric restrictive device. And for laparoscopic adjustable gastric restrictive procedure, you need to refer 43770 to 43774. The next CPT is 43860. It deals with revision of gastrojejunostomy anastomosis. Gastrojejunostomy with reconstruction with or without partial gastrectomy or intestine resection without vagotomy. The previous CPT is without vagotomy, and if it is performed with vagotomy, the CPT is 43865. The next is 43870. Closure of gastrostomy surgical. The next is 43880. Closure of gastrocolic fistula. For the closure of gastrocolon fistula. The CPT is 43880. The next CPT is 43881. Implantation or replacement of gastric neurostimulator electrodes antrum open. Previously, we have discussed the laparoscopic procedures in the laparoscopy topic. Implantation or replacement of gastric neurostimulator electrode antrum open. The CPT is 43881. The next CPT is 43882. It deals with revision or removal of gastric neurostimulator electrodes antrum open. And for laparoscopic approach, you need to refer 43647 and 43648. Next CPT is 43886. It deals with gastric restrictive procedure open. Gastric restrictive procedure open. Revision of subcutaneous port component only. And for the removal of subcutaneous port component only, the CPT is 43887. And for removal and replacement of subcutaneous port component only, the CPT is 43888. And do not report 43888 in conjunction with 43774 and 43887. And for laparoscopic removal of both gastric restrictive device and subcutaneous port components, use 43770. And for removal or replacement of both gastric restrictive device and subcutaneous port components, use 43659. And finally, coming to the unlisted procedure stomach, it is given by 43999. Now let us see an example. What CPT code represents the creation of an opening into stomach to insert a feeding tube for nutritional support for an adult patient with proximal esophageal carcinoma due to alcohol dependence, and here a gastric tube was not created. An opening is done in the stomach. That is nothing but gastrostomy. Ostomy means making an artificial opening. So gastrostomy is performed here. Gastrostomy without construction of gastric tube. Gastric tube was not created. So the correct CPT is 43830. Gastrostomy open without construction of gastric tube. So thank you for watching. Please subscribe for further videos on medical coding and CPC training.